what I want to talk to you about is some experiences, some approaches that I've used that have been successful in my career that all of you can relate to. So I'll share some stories about PartsSource and specifically the healthcare IT industry. But really what I'm going to talk about applies to all of you, regardless of what industry you're in or regardless of what role you're in. So let me tell you a little bit about PartsSource and kind of give you some historical background that I'll weave into this presentation. So PartsSource was founded in 2001 as a medical parts distributor. So every day in hospitals around the country, medical equipment fails. It could be everything from a caster on a bed to an expensive x-ray tube. And PartsSource provides replacement parts, service parts, for all of those different modalities, all the different equipment in a hospital. Back in 2001, we prided ourselves on being able to provide a quote for a part in 2 hours or less. And that was like rock star crazy good back in the day. And believe it or not, even today, most of the industry is a quoted industry. Hey, this part broke, I need a quote on this. Oh, let me call you back, I'll get a quote on that. And so over the years, we implemented some technology, we implemented some processes, we separated our sales folks from our sourcing folks so that we could streamline that process. Salesperson would get a request from a hospital for a part, they would send it over to the sourcing team, they would contact the supply chain, provide options back to the sales rep, and get the quote back to the customer with different options. Could be an OEM original part, could be a replacement part, could be a refurbished part, depending on their need. And so over the years, we took the quote down to 15 minutes. We're high-fiving each other, thinking this is great. You know, we're at 15 minutes to give a quote, leading the industry and turning around a quote for medical equipment. So you can imagine if an x-ray room is down, you know, patients are being canceled, hospitals bleed money, so it could be a very big deal. And so finding the right part, fixing the broken piece of equipment is critical in many cases, sometimes, you know, life-saving, life-threatening. So we continued kind of down this path of optimizing and streamlining our internal processes. And around 2010, 2011, we realized that, you know, we have 10 years worth of cost data for all these parts from various suppliers. We manage about 10,000 suppliers. It's a very, very fragmented space. And we have about 10 years of pricing data, what we typically sell these parts for to customers. So why not just provide an instant price? Let's just price it. And so that's what we did. And within 3 months, 22% of our parts requests were automated, or we would say auto-sourced, meaning we could give the customer a quote immediately, and you know, they wouldn't have to wait for a call back or, oh, I'll send you an email with a quote. They could get a price immediately, and it improved our close rate. And again, we're high-fiving each other, thinking we're great. So within the first 3 months, we saw that kind of growth. So we were very proud of ourselves. However, when you look at it from the customer's point of view, we were disappointing customers 78% of the time. So 22% of the time, we could give them an instant price, which is great. Nobody had done it before, but we actually created a new problem. And the problem was, you know, why can't you just give me an instant price for this? Why do you have to call me back? And so we kind of stumbled into this opportunity. We were viewing it internally. We were looking at it as a productivity, a streamlining, an efficiency gain from our internal processes. We didn't bother to think about it from our customer's point of view, and they kind of forced it upon us. So we basically solved it through brute force. And what I mean by that is every day we get about 2,500 parts requests. And a couple years ago, on a typical day, 300 of those part requests were brand new parts that we had never seen before. In the 13 years prior, they were brand new parts. So there's a very, very long tail in medical equipment parts. Just some quick stats, there's about 1,200 different OEMs, manufacturers of medical equipment, right? GE, Toshiba, Siemens, Welch Allyn, Stryker, Hill-Rom. You walk into a hospital, and if you imagine looking in a hospital room and look at all the name badges and all the equipment in that room, there's a lot of name badges. And a typical hospital deals with 400 or 500 different manufacturers. And of course, there's a whole secondary market that makes parts that fit on those manufactured machines. So it's a very fragmented space, and the wearable parts it's a very large number, and it's a very long tail. And so by brute force, what I mean is we put together a catalog operations team, partnered with our supply chain team. Every day we would get those 300 new parts requests that we'd never seen before. We would do the supplier research, add all the attributes and data into our system. So the next day, when those requests came in, we would have it in our catalog and it could be automated. It could be instantly priced. But it took us a long time to do that. The tail was a lot longer than we anticipated. The team, we were constantly looking at our request volume and focusing on our frequently requested parts, but the tail was fairly long. So I'm proud to say that we're near the end of the tail. For example, yesterday, I think we loaded 20 parts, 20 that came in that we hadn't seen before, down from 300 a couple years ago. So now, actually last month, 87% of our orders come straight from our catalog now, which is great. So that's just a quick little history of PartsSource and how we've kind of morphed from a medical parts distributor to more of a technology company. But this really is just scratching the surface. We kind of stumbled upon this opportunity, again, by trying to do an internal productivity initiative, but we really didn't become competitive and become strategic until we started solving some customer problems. So that's a little history of the brute force and the opportunity, but what I want to really talk to you about is how we started leveraging technology to be more of a strategic competitive advantage. But the first thing we had to do is talk to our customers. Now, when I say talk to our customers, you're probably all thinking in your mind, oh, I know who my customers are. And you're thinking of maybe the business name of your customer. It could be a B2B, it could be a B2C. You might be thinking of end users. When I think of customer, I'm talking about the end users, the users of our product or services, the people that are actually getting value from PartsSource. And so talking to your customers seems simple. You might think that you're doing it, and maybe some of you are, but that's what I want to talk to you about, is really solving your customers' problems. And I'll give you kind of an approach and weave in some stories around that. So the first thing we had to do was figure out who are our customers, right? Simple question. And when we really started breaking it down, we realized that we had customers, specific users, that really had different needs. And so we broke them down into what we called personas, which is really just a definable group of users or customers that share the same problems. So we started asking, what matters to our customers? The needs of a CFO at a hospital are different than the needs of a biomedical engineer at a hospital. And so we needed to segregate them and put them into different personas so that we can more accurately and better serve their needs and solve their problems. This is when the company and the technology in our business really took off, when we actually started identifying problems that our customers had and then started solving them. So we realized that PartsSource is really more of an online marketplace. We sit in between suppliers and customers, providers, hospitals over on the customer side, OEMs and distributors on the supply side. And we actually provide technology to both sides. And both sides are dramatically different when you start thinking about what problems do they have and what can we solve, especially with technology. So I'm going to spend a lot of time talking about external customers, revenue-generating customers, but customers can also be internal. And for a lot of you, your customers are the accounting department, marketing department, sales, operations. Your internal users can also be considered customers. And I'll talk a little bit about both, and everything I want to talk to you about applies to both, internal customers and external customers. So it's a pretty interesting exercise to get some of your leaders in a room, and that's exactly what we did. We went off-site, and we asked a simple question: who are our customers? And we started defining them and breaking them down and distinguishing them based on what matters to them. So we asked, what matters to them? And do they have any unresolved problems? Now, that's a good exercise to go through, but on the other hand, none of it really matters. It doesn't matter what I think is a customer's problem. The only thing that matters is what the customer thinks their problem is. So we had to get out and talk to customers. And so we did that. Now, identifying problems, again, sounds easy, It was talked about in the innovative session this morning. But if you think about it, sometimes problem solving is very difficult. Even identifying problems is very difficult. So let's make this a little bit interactive. Let's pretend that I'm a product manager for a television manufacturer. I'm assuming everybody in this room has a television set at home. So you are all my customers. You're all users of a television. My job as a product manager is to differentiate my television, my brand, from all the other ones. So let me ask you, what problems do you have with your television? If I was trying to identify problems in my market space, what could I solve for you? What are some problems you have? Anybody? Yes?
Integration with all the peripherals.
Yes. Right. My wife complains constantly because she never knows which remote to pick up. It's simple, honey. There's 7 of them here. This one's for that, this one's for that. But yes, exactly. Integration with all the other devices. What else? Yes?
Making them small, you get great quality of sound.
Yes.
I got to buy a separate device to use.
Exactly. I can relate to that. I just bought the biggest TV that could fit in my little built-in cabinet in my living room, and I couldn't hear it. I turned it all the way up, can't hear it. So I had to buy a little surround sound bar, of course. Maybe that's a racket and they're trying to get me, but yet another device and another remote, by the way, because my TV remote doesn't control the sound on that remote. Great. What else? Wi-Fi. TVs now have Netflix and the internet built in, but trying to configure the network settings on those is a bit of a nightmare. I kind of know a little bit about networking, and it's a nightmare. Sometimes you get the Ethernet to work, sometimes you can't. You can only do one or the other. I think we can all relate to that. What else? How many of you have ever lost your remote control? Right? So this is a classic example. When I asked you, all of you are end users, you're all consumers of my product, a television, and yet none of you thought of, golly, I lose my remote control. Kids lose it all the time. It's in the seat cushions. I found it in the refrigerator one time. I mean, it's all over. So back in the 1990s, a company called Magnavox, their product team faced this very same problem. Right? You go into an electronics superstore and you see the big wall of TVs. They all look the same. Right? So how do you differentiate? Oh, this one has picture-in-picture, which you'll never use. This one has picture-in-picture-in-picture, which you'll never use, right? So they added a lot of engineering and a lot of features and things to it, but they weren't really solving customer problems. So Magnavox actually went out to the marketplace and asked consumers the same question I asked you. And they came up with some similar notions, and this was in the 90s, so the Wi-Fi wasn't there and the integrated devices wasn't a big problem. But they said things like, you know what, the sunlight kind of glares on it sometimes. Sometimes it's hard to use the remote, too many buttons on it. And then they actually sent product people, into the field to just observe the habits of people watching TV. And guess what they found? They lose the remote all the time. They found that 80% of Americans, they did surveys and they did on-site studies, 80% report losing the remote control. 50% report losing it 5 or more times a week. And they had all kinds of stories about where people found the remotes. You know, it was on the hood of their car the next morning. You know, they went out in the fridge, out in the freezer in the garage, whatever, set the remote down and forgot where they put it. So Magnavox came out with an innovative idea. How about you just hold down the power button on your television and your remote will beep for 30 seconds? So they solved a customer problem. And it really helped them with their business. So when we talk about the spectrum of identifying problems, I put this one way over to the left, meaning you have to talk to your customers. And even when you do, many of the times they can't articulate what their problems are. So you have to observe them, you have to shadow them, you have to probe them. It's really an art to try to figure out what their problems are. On the right-hand side of the spectrum, it was actually mentioned in an earlier session today, consumers have no idea. They can't truly see the next product or the next innovation. And so they might be able to give you insight into their problems, and you can gather problems and put them together and solve them collectively. And that's when you have true innovation. And that's kind of the right side of the spectrum, right? In the early 1900s, Henry Ford asked people, what do you want in transportation? Oh, I don't know, a faster horse, right? They couldn't really conceive of this automobile. And even more recently, right, with laptops kept getting smaller and smaller and we had netbooks. Well, what can I do? What problem do you have with your netbook? I don't know. Can you make it faster? But they didn't really, conceive of the tablets, the iPads and the tablets. So this is kind of a large spectrum in terms of solving problems. And I have found that it usually ends up somewhere in the middle. You can never beat actually talking to your customers, but you really need to quiz them and talk to them. And a lot of times they'll tell you the solutions they're after, but not the problems. And so it's more of a conversation. And you have the same conversation with several customers, several people in the same persona, and you start to see a pattern. So just a little tidbit there on identifying problems. It's not as easy as you think, as many of us know. So here's how I think of PartsSource. PartsSource is in the business of solving problems in our industry. That's it. It's that simple. That's my job. I solve problems. I do it every day. My team solves problems. PartsSource solves problems. And that's how we've been competitive, and that's how we've been strategic. So we went out and we talked to customers. So we have a bunch of problems. We have personas. We have a whole list of problems. You probably have a big, long backlog of bugs, enhancements, projects, initiatives. You can all think of the workload on your plate. So how do you prioritize that? So great, we've identified some problems, but how do we know which ones to work on? So I use a very simple litmus test. It's an impact scale, and that's it. It's that simple. It's low and high. And it can have different measurements. It could be an impact from financial, from a revenue-generating potential, from a cost efficiency, from a productivity, internal productivity potential. It could be the number of users that it impacts. If you fix these three problems, it'll solve the problem for 400 people, 400 employees in your organization. That might be considered a high impact. So it's fairly subjective, but it's a great way to kind of categorize and look at all of your problems and bubble up the ones that you believe are going to be the highest impact. Then you can go into ROI, business case, and spreadsheets, and more detail if you need to find budget dollars or justify working on a particular project. But before you do that, I would encourage you to take a more simple approach to just look at the impact, low to high. And again, you're going to have different impacts based on number of users, based on dollars, whatever it can be. But that'll at least help you focus to the top projects and initiatives, and then you can go through your typical business process to get justification and get going on them. I would also encourage you at this point to kind of step back and think about the problems you're going to solve. They've probably already been solved, maybe not in your industry, but don't reinvent the wheel. Don't make it hard on yourself. So for example, prior to the healthcare industry, I was in the automotive industry, and a lot of what I did with FordParts.com, for example, I'm now applying to healthcare. So what I did for automotive OEM parts, guess what? It applies to medical parts. A part is a part. And I think automotive is in general, especially on the parts supply chain, about 10 years ahead of healthcare. And so I've just leveraged some of the problems I've solved in another industry to kind of leapfrog the competition in healthcare. So I would encourage you to do the same. So with that, we went out and we started talking to customers. So, and again, when I'm talking about external customers in this example, so my team always hears me say, the answers are not in this building, right? They're out there in the field. So great, Mr. Software Engineer, you've got this smoking fast, high-end laptop, and that looks really good on your 17-inch screen, but our customers are using a 15-inch screen, and it's got Post-it notes and grease and things all over it, and it doesn't work as well. And so it's always good to get into the environment of the end users. Get out of the building, talk to end users. Now, for part of my team that supports our internal users, they've got it made. All their customers are in the building. They sit 50 feet away. Go sit with them. Go visit them. You can get feedback every single day. I know that's easier said than done, but I'll talk a little bit about that as well. So we went out and we started talking to our customers, and we found some problems they had. We shadowed clinical engineers, biomedical engineers. They're diagnosing equipment, they're fixing it, they're walking through their day, and we realized little things that you wouldn't pick up in a conversation with them, in a phone call. Hey, what are your problems? they can't really articulate them because many times it's just part of their job. That's what they do every day. They don't consider it a problem. So for example, one of the things that a lot of our customers do is they identify the part they need. First thing they do is they call the OEM. Sometimes they get put on hold, sometimes they leave a voicemail, it goes back and forth, and the only reason they're doing that is to get a list price. And then they have a reference, and then they start calling other suppliers to get prices and quotes so they can save the organization a little bit of money. And so we said, well, what if we just always show you list price? We have list price. What if we just put it online for you? And the other thing we heard was, well, great, PartsSource, you can give me instant pricing, but I still have to call to get it. Why can't you just put this online? So we did. We put our catalog online so they can see the pricing. And of course, we solved other problems just by doing that. So they could also see the photo and the schematics and the illustration. In the healthcare industry, and in many industries, when you're dealing with preventative maintenance and replacement parts, parts ID is a big problem. If you order the wrong part, it takes a couple days to get there, you get the part, you go to fix the machine, it's the wrong part. The machine is still broken. You didn't solve the problem. Now you have to order another part. So the simple notion of putting photos and schematics and illustrations right there in front of the customer so they can say, yep, that's the right part. It solved another problem. So as you start having these conversations, you'll start solving more and more problems, and the momentum just builds, and that's when it gets really exciting. So we've had a lot of success with that. You know, our hospitals using our technology to actually order parts has risen and continues to rise. Let me go a little bit deeper into a story about one of the problems we've noticed. And again, not one of our customers articulated this as a problem. In all of our surveys, all of our phone conversations, all of our field visits, they could never identify this as a problem because that's just the way it was, right? That's just the way they were used to doing business. And here's the problem. So let me just give you the quick workflow that many of you can relate to. Clinical engineer in a hospital gets a work order. Let's say it's a broken infusion pump up on the 7th floor of Building B of a hospital campus. Clinical engineer can either go get that asset and bring it down to his shop for diagnosis, or he'll just go up to it and diagnose it on the spot. So let's say he goes up there, walks over to Building B, goes up to the 7th floor, finds that infusion pump, does his diagnosis, identifies, oh, he needs this replacement part. So a typical scenario is, writes it down on a Post-it note. Maybe while he's up there, he visits a few other work orders in the area, maybe stops to get a cup of coffee. By the time he gets back down to the shop, an hour has gone by. Then he starts making phone calls, calls the OEM to get a list price, starts calling some other suppliers, spends a half hour on the phone to save $10 trying to find this part. By the time he finds the supplier, sources the part, gets a PO requisition, enters it in a system, another hour's gone by. And we actually did this. We actually did time studies. In fact, the Cleveland Clinic did a time study, and they estimated that each of their technicians were spending 1 hour per day per part just ordering and entering the part into their system. And that's a huge problem, but nobody thought of that as a problem because that's just the way it's always been done. So we thought, well, what if the technology could follow them? What if they didn't have to write it down in the Post-it note? What if they had a mobile app or they had some sort of technology where they could just either take a picture of the part or just enter the part number since they're holding it and verify it in a catalog, verify it with photos, and actually place the order? And so that's what we kind of came up with from a concept point of view. We thought it was cool. Now, when I say we, the technology guys, we had all kinds of great ideas, right? Oh, they could just dictate the part number into their mobile phone, or we could scan a barcode, all kinds of cool things we could do. But none of that really mattered until we talked to our customers. And so that's exactly what we did. We host a customer advisory council every year. We get together leadership from large hospitals around the country. And a couple years ago, I hosted a brainstorming session on this very phenomenon. So they could all relate to it. They all identified it as a problem, even though none of them told me it was a problem ahead of time, even when I asked them. So you have to kind of lead them with questions and guide them down the path. And so they agreed that, wow, technology or some sort of mobile application would really be beneficial here. Several of them volunteered to pilot with us to help design the application, and so that's exactly what we did. We iterated through different various mock-ups, some screens, some workflow, network coverage, security, all the typical things for a mobile application, and then some because we're talking about hospitals. So security and compliance are relatively high. So we continued partnering with hospitals. We actually built prototypes of the app, provided them with multiple devices, tablets, phones, etc., and had them walk through and use the technology and provide us feedback on it. We worked through the security, the provisioning, did some beta testing, and we finalized on our mobile application now that, again, has been very, very successful. Why is it successful? Because it solved a problem that they all had. Now, and their problems differ. Biomedical engineers have different problems than diagnostic imaging technicians. Kind of work in different segments of the hospital, and they have different problems. But the single mobile app can actually solve both of their problems. And so it became wildly successful just because we solved a problem that nobody had thought to solve. So what I would offer up is you are in the business of solving problems. If you think about what you do, the emails you're looking at right now, the problems you're facing today, the problems you're facing this quarter, the problems you're going to face next year, they're problems. And your job is to solve those problems. They might be internal, they might be external, they might be innovative, they might be R&D, they might be optimizing the system, increasing performance, whatever they are, they're problems, and they matter to somebody. And finding out who they matter to and how much they matter to those people is what's key. So just to kind of recap, what I would offer up is talk to your customers. And I know you hear that a lot, and believe me, it's hard to do, especially if you have software engineers that you want to sit next to salespeople to see how they use their application. Sometimes it doesn't gel well. I know. You have to kind of force it. But believe me, it works. And all it takes is a simple introduction. Sally, this is Joe. Joe built the screens that you use every day. Sally uses Joe's screens every day. Have at it. And you just let them sit together for a half hour. And I've done this. And afterwards, I'll walk up to Joe. Joe, what did you learn? Oh, it was amazing. Sally processes our returns. But when she gets a phone call, she writes it down on a notepad. And then she gets an email from a sales rep, and she drags it into an inbox folder in her Outlook that only she can see, and that's her queue. And we built this big returns queue that she's not using. So I asked her, why isn't she using it? And she said, oh, it's just too cumbersome. If I'm on the phone with a customer, I can't get to the screen fast enough to get the information. So I jot it down. And then I email myself a reminder. And then I'll email the sales rep, and then they'll email me, and now we've got a whole system outside the system. And so Joe started asking Sally, well, what happens when you're on PTO? What happens when you're sick? Does somebody else pick up your tablet? She goes, no, I guess not. It just sits there on my desk. So that's a big problem. And so just by shadowing Sally, Joe had a tremendous insight. And now Joe has a relationship with Sally. So guess what? When Joe goes to optimize code or build screens and workflows, he has a power user in Sally to kind of bounce ideas off of. And it works. I know sometimes it's hard, sometimes the cultures clash, especially internally, but it works. To the extent you can get IT sitting with the business and understanding what they're doing, it'll pay off in spades. Identify the problems, right? Just like Joe identified problems Sally had. Just like we identified problems that our engineers had in hospitals. Talking to the customer, actually seeing it in their own environment will identify problems. And it's hard, just like the identifying problem spectrum I went over. On a typical day, or whenever I have free time, I like to go on what I call a walkabout. I walk about PartsSource. And I'll just walk up and down the rows of cubes and randomly stop and talk to a sourcing person or a salesperson. Hey, how's it going? How's the system running? We have a homegrown sales order processing system that we built. Now, they usually tell me what they think I want to hear. So it usually takes a few probing questions to get down to what I want. And a lot of times I'll just say, oh, please continue doing what you're doing. I'm just going to look over your shoulder. And, they might pick up a phone call, key in some things, and I'll say, well, it took about 12 seconds for that screen to load. Is that how it always is? Yeah, it seems a little bit slower lately, but yeah, that's about how it is. Well, how many times do you go to that screen a day? Well, I go there 2 or 3 times for each order, and I process about 60 orders a day, and I'm starting to cringe, right? So I wouldn't know about that problem unless I had walked by and asked those questions, or unless there's a squeaky wheel, or it becomes a big enough problem that now you're in reactive mode instead of proactive mode. So having those conversations, breaking down those barriers is just critical. Not only from a PR point of view, but you can actually add a lot of value. Define the personas. Once you identify problems, you can say, wow, you know what? If I fix this problem for sales, that also impacts finance. Wow, I could put a big number on that. Or if I fix this problem for the biomedical engineers, it's going to do wonders for the imaging technicians because they're even more mobile. And so as you start to segregate these problems and group them by personas, you realize that, wow, these problems, if I put these 2 or 3 problems together, it's really going to have a high impact. And that talks about, quantifying the impact. My simple scale, low to high. It's interesting when you talk to customers, internal customers or external, a lot of times they can't articulate the problem. Just like we couldn't, recall that, oh yeah, we were losing remote control. That's a typical problem. And so a lot of times they tell you a solution. And you kind of have to peel back the layers to try to figure out the problem they're talking about. So I'll give you an example, another internal example that a lot of us could relate to. Standing over the shoulder talking to one of our supply chain people. Hey, do you have any problems? Do you have any ideas, any enhancements? Everything working good with the system? Yeah, you know what? If we had a notes field on this screen, and again, I cringe, right? Notes field, you can't automate. It means the human has to read it. It's no good. We all know that, but end users don't really seem to pick up on that. And so, oh, well, what would you put in that notes field? Oh, well, I would like to put in a comment, like this particular supplier has poor on-time shipment results. So I'd like to put that in there for my sourcing and supply chain team to see. Well, we track on-time shipments across the board. We could easily automate that for that particular supplier and put a percentage score, red, green, yellow, right here on the page and let you know what his on-time shipment percentage is, or his when he misses on-time shipments. Oh, that would be huge. So he gave me a solution, the notes field, and it's real easy to get that into a help desk request, right? Or it goes into the system, it goes through an email, it goes through a process. Suddenly we've got software engineers building the notes field because somebody asked for it, but that doesn't solve the problem, right? And so even as you look at your existing backlog of bugs and enhancements, ask what problem are they trying to solve? And you're going to find that if you group 3 of these things together, it might be relatively low effort, but it's going to have a huge impact. And that's when the magic starts to happen, when you start solving problems, whether they're internal or external, and having a big impact. And like I said, you're going to have more and more of those conversations. You're going to build up those relationships, and the momentum's going to grow, and pretty soon you're solving problems every day. So I would offer up doing all of those things before you write code, before you write a report, you do an integration, you build an application, you do an enhancement. All the things I've talked to you are really about leading up to the work. I'm not even talking about doing the work. But they're important things to do. Otherwise, we're just off fixing bugs. We're adding notes fields. We're doing whatever, and we're not really solving problems. There's my contact information. I'd be happy to answer any questions. You can email me or call me any time. And if there's any questions right now, I'd be happy to answer them. Did we stay awake right after lunch? I was going to scream a few times throughout the presentation just to make sure you were... Yes, Brad. We are, and it's an interesting question because it's real easy for someone like PartsSource to say we don't have any competition. There's really nobody else doing this. We're the largest multi-modality, multi-vendor parts distributor out there. All we do is medical parts. It's a very little niche market. It's actually a $12 billion market a year, so it's a large market, but no one would realize that, right? Hospitals have no idea what they're spending on parts. It's like, yeah, whatever it takes, fix the x-ray machine. I mean, it's almost to that mentality. But now with regulatory, healthcare reform, cost containment becoming critical in healthcare, they've really automated all other pieces of the hospital. Patient entry, billing, the clinical side, and now they're getting down to supply chain and parts procurement and service and labor and things like that. And we're primarily focused in this space. It's all we do. And so we like to think we're on the bleeding edge and we don't really have any competitors. But we can't compare ourselves to who our competitors are. We compare ourselves to Google and Amazon and other industry players because we always want to aspire to be like them. So there are some OEMs, there are some large hospitals, integrated networks that have large supply chain teams that are doing a lot of the things that we're doing. But a lot of them are also licensing our technology because they don't want to reinvent the wheel. We've solved the problem for our business, and we'd be happy to license that technology for them to solve their problems as well. Good question. Anything else? Yes? Yes, it was iOS and Android. No, good question. We spent a lot of time batting around, and it was interesting because the technology guys, my team, was telling me one thing, and my customers were telling me another. And it's interesting, even in clinical engineering, they're just starting to roll out smartphones and bring your own device and iPads and things because of security. And every nurse has their own iPhone with her, and every doctor has his own iPhone, and they're bringing them in anyways. And so we had to partner with a lot of hospitals to either provide them devices, partner with third parties to help secure the devices, so we ended up opening up more problems that needed solved. We could build a killer app, but if nobody has a mobile device to use it, it doesn't do any good. And so we basically went off from what our customers are doing. They were either rolling out iOS or Android, and those were the two that we focused on. Another question, yes?
So when you're going after customer feedback and input, to what extent do you like to leverage your information in your contact centers?
Good question. So I have a couple thoughts on that. So the contact centers, customer care is usually the best source of information from your customers because those are the complaints. Those are the problems. Those are what's wrong. It's a great source for information. You'd be amazed. And if you haven't done it, I would encourage you, regardless of what industry you're in, to sit in and listen to some calls. Listen to them talk to customers, whoever your end users are. I'm sure you have a support function. Listen to the problems. Comb their database for problems. You're going to see patterns. You're going to see things that again, make you shiver. Oh, all these customers are having problems. That's easy to fix. We've had that in our bug list for 2 years. I didn't know that was that big of a problem. On the other side of that, I would offer up, and then this is kind of my opinion, I don't mean to generalize, but there's a big difference between talking to the market and listening to the market. So what I mean by that is a lot of times the sales force, they're out there talking to customers, right? And they're going to come back with ideas. This customer needs that, this customer needs this. And a lot of times it's really related to a deal. It's related to one customer, and you end up doing some custom work. So you're driven by a customer, not the market. And so there's a big difference between talking to customers and actually listening. When I say listening, I'm talking about the examples I gave you where you're engaging in a conversation to understand their problems. One more question? Okay. Well, thank you very much. Thank you, Brad.